Secondary causes. Secondary causes of hypothyroidism. Now, in this, he has mentioned again a lot of points, but I think I will leave it for you all to see in the book. It's very simple. He's mentioned the symptoms and he's mentioned that the clinical signs of each particular condition. Now, one thing he's written over here, which I think needs an importance from my side, is the goiter. Now, goiter, I will try to add a video. I'm not sure whether I'll be able to do it, but I'll try to add a video on the examination of the goiter. Goiter is any swelling of the thyroid gland, okay? And here, Dr. Dhanipkar has taught us how to examine it from first, like we have been taught this in medical school as to how we check the temperature, we check the borders, we check the consistency. For example, if it is hard, soft, lumpy, rubbery, then we have the pulsations felt. Perspiration in that area. Is there pain when the patient is being examined? Does the patient cough when we examine? So these are some of the things that he mentions, and he, of course, every single one of these things which he has mentioned has indications in homeopathy. So if it is a hard goiter, if it is a soft goiter, if it is lumpy, if it is rubbery, each one has its own. Now, then he talks about how the goiter is in the neck and it sometimes enlarges in the posterior part and causes a cough. So goiter-related cough. And then we have remedies like spongia, bromium, and other ones that come up. Then the goiter which grows upwards. So you feel as if almost the chin and the neck are one. So the goiter that grows upwards. Then you have a goiter that grows more in the right side, more in the left side. So all these have different indications. They're all there in the book, all of it. But I'm just trying to share with you how to. So when you're reading this, you have to understand, okay, this is the way I have to examine the patient in order to get these symptoms. That's where I come in, and that's what I'm trying to help you in. He has shared everything, Hashimoto's disease, Graves' disease, how to examine it, when does it come, what are the confirmatory symptoms, what are the confirmatory investigations. All of it is there, and it really helps us in prescribing. The cancer cases. I will come back here because actually that's written later on as to what are the remedies when we examine the goiter of the patient. We'll come back to it when we are discussing the repertory. Then he has one thing which I think is an important one, which I don't know where Sir got it from, but then it's an amazing insight into the role of the thyroid gland in female disorders. So this can be menstrual disorders. This can be infertility. In menstrual, it can be decreased, increased, or irregular. Okay. And It can also be infertility. And he has mentioned, again, the medicine side of it. Now, this is important because, again, remember we were discussing in the beginning about the hypothalamus, which regulates the anterior pituitary, which regulates the thyroid gland. Which regulates the thyroid gland. Now, when we are looking at symptoms of menstrual disorders which have its origin in the thyroid, which means if I see a patient who's got menstrual irregularities and there is no PCOD in the patient, but the patient's menses are not regular, then I will think of thyroid as one of the causes for this irregularity. This does not mean that if a patient has PCOD, they don't have thyroid, please. I am only talking about it to give you a clarity on the role of the thyroid in menstrual disorders and in infertility. So here, Dr. Dhanipkar mentions how the menstrual dysfunction from dysmenorrhea to amenorrhea, all of this is really related to the hypothalamus, okay, which increases its secretion of TRH. And that increase leads to either pain or decrease or increase of menses. Okay. Another thing which he talks about is amenorrhea, which is due to prolactin, which interferes in the production of estrogen, which causes amenorrhea and infertility. Now, when I'm talking about prolactin, please go back here. Prolactin is secreted by the same anterior pituitary gland that secretes TSH. They also have a postulated theory where there is, in hyperthyroidism, there is a secretion of a sex hormone binding protein. And this prevents ovulation and leads to scanty menses and missed periods, and of course, infertility. Now, when we see this, we will see that menorrhagia, which means increased menorrhagia, which means increased menses or prolonged menses. If this is a particular thing that's happening, it is because of the hypothyroidism, not hypothyroidism. Okay. And he also talks about, okay, menorrhagia due to coagulative factors which are affected because of the hypothyroidism. So it's actually a bleeding disorder more than, so hypothyroidism causes a particular kind of bleeding disorder, which leads to menorrhagia. We see this in calcarea carb. Now, he has also differentiated goiter according to the stages of life. So if you have in children, in babies, in puberty, every change of life, there is a change in the thyroid requirement, which, if it is not physiologically healthy, goes into a pathological production of, so pathological goiter, which can be hyper or hypothyroidism. So you can have it in children if this is neonatal, or if it is because of maternal issues, whatever. But then you can have it in puberty, you can have it in pregnancy, and climaxes or menopause. So postpartum thyroid disorders, and each one has different indications. So you have here, you have baryta carbon nitric acid. In puberty, you have calcarea iode and thyroidinum. In pregnancy, also you have thyroidinum and calcarea iode. In climaxes, we have, I think it is ferrum iode is there. I know that. And now I don't remember. There's some more. So now what Sir said is that if the patient has decreased TSH and menorrhagia, and we see a picture of thyroid in a case of calcarea carb, so we'll think of giving calcarea iode. Make sense? He's written things which are very practical. You will not find it in your Materia Medica, and you won't find it anywhere. You have been given something which is amazing. Please, please, please use it. Goiter from grief. This is there in Fatak, which Sir has written here because the book is on thyroid. So it's amyl nitrate and chloralum. So every time it's not ignitia. If it is goiter from grief, think of amyl nitrate or chloralum before you think of ignitia. Then he's even given remedies according to conditions. So if it's toxic goiter, think of lycopus. If it is cancer of the intestine with goiter, think of cadmium met. If it is cardiac complaints with goiter, then think of cactus, arsenic, lycopus, spongia, squilla, thyroidinum. And then when you read Sir's Materia Medica, because Sir has given a repertory and a Materia Medica. So over there is only one remedy with enlargement of the left ventricle along with thyroid, that is aurum met. So please read the Materia Medica and then please read the repertory. The repertory, none of these, neither the Materia Medica or the repertory overrides what we have studied from all the textbooks of Materia Medica. This is only trying to get as much as possible, collating a certain amount of indications in one place. Please, 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 this is not a final book only for thyroid. There are many other remedies which are used for thyroid disorders, which may not be in this book. There might be many more indications which may not be in the repertory. This is not complete. These are guiding points for you, but it is surely something that will improve your clinical practice. Now, he's even mentioned, that's very sweet of him. So Sir has even mentioned when he gives, like say, suppose he says, if the swelling involves the whole chin, the only remedy is spongia. If the gland is enlarged, then he'll think of iodine and chromium. If there is swelling, but it's not much, it's light, then he'll think of giving thuja. And then he will think of giving spongia. So when he's giving you clinical signs which have been tried and tested in his clinic for 5 years before he released his book. This is not just a collation of data. It is a confirmed set of advice that you know have worked clinically. If there's face swelling, think of thyroidinum. Now, even when he was talking about the examination of the thyroid gland, which I was talking about here, he mentions pain, painless. Now, these things are there in his, so he's even given us a thyroid case paper format. which is for giving it to thyroid patients for them to fill up, which help us get the right remedy for the thyroid. Please note, this is above the constitutional prescription. You will have to give, and you will have to understand the constitutional prescription also from that same case format. And you must also be able to perceive the indications of the remedies for the thyroid gland in that same case performer. But so that we don't miss these points, like, is it painless or is it painful? Is there perspiration? Is there pulsation here? So just so that we don't miss it, he has made a specific questionnaire for thyroid cases that come to you. Menses, we don't take just, okay, increased menses, no menses, less menses. When you study with us, Dr. Dhanipkar and me, you will see that this is not how we do it. We even ask for the quality of the bleeding. We will ask about when the bleeding is worse, when the bleeding is better. We'll talk about the type of pain, when does pain get worse, better. We're looking everywhere for PQRS symptoms. We're looking for my modalities. We're trying to understand what exactly is causing that dysmenorrhea or metrorrhagia or menorrhagia in the patient. So here he's mentioned a few more remedies, like if there is pain on swallowing, then it is spongia. If there's an aching pain over there, it's phytolacca or ammonium carb. If there's a sensation that you're breathing through a sponge, it is spongia again. So he's mentioned a few tips that you will look for. He's written concomitants of goiter. So if there is goiter with trembling, it's mephitis. If there is external itching of the goiter, it's ambragresia. If there is joint complaints involved, it's thyroidinum. Menses affected due to the thyroid, it's natrum carb, platina, and spongia. So he's given you a lot of symptoms here, which I want you to go through. And these are, he's correlated it. So he's given you a part of the question format, what you're going to ask, and what are the implications. What are the remedies you think of if the patient answers this, answers that? If there is increase of appetite or decrease of appetite, what are the remedies that increase appetite, like iodine, bromium? What are the remedies that will decrease the appetite? You might think of natrimute. Natrimute comes in ravenous appetite as well as decreased appetite. But yes, so every question that you're thinking of, you are also thinking about the remedy that will work specifically on the thyroid gland. And this may not or may be the constitution. So you may have a natrimute patient who is suffering from goiter, but you may have a patient who is maybe platina, but suffering from goiter and will need natrimute for the symptoms of the thyroid later on in the course of treatment. If there's anemia associated with the thyroid, we think of ferrum and natrum. So these things in the questionnaire, he's given us a gist of what are the things that we have to look for when it is associated with thyroid. Another thing which he has very beautifully mentioned is the use of ferrum iode in goiter after menopause. Now, when we say menopause, there are some patients who've had a hysterectomy because of excessive menses or things like that. And when that happens, they do a hysterectomy, and that can be considered in two ways. One is that it is menopause, and the other is that it is suppressed menses. So in both the cases, you will have ailments from suppressed menses or ailments from menopause. The remedy is ferrum iode. If during puberty, menarche, there is increase in the bleeding, we can think of thyroidinum. Now, the thyroid gland, this also has been taught to me by Dr. Dhanipkar. The thyroid gland is stimulated. If you see a thyroid investigation report, you will see that there's a different range for different ages, and there's a different range for the first trimester, second trimester, the last trimester, and menopausal women. And this is because the thyroid um, requirement changes when the patient enters puberty, because then they start getting their sexual organs which are developing. They're going to get their menses. Then during their in the beginning of their pregnancy, they're going to have to they're going to grow. There's going to be increase of growth hormone, increase of metabolic rate to grow the fetus. Then each one of these trimesters are going to have a different range. Menopause also has that same kind of action on the thyroid. So when we are asking a patient, of a female patient of thyroid, these are very important stages of life that we have to cover and see, correlate whether any of these the thyroid symptoms began at these particular stages of their life. And again, this will also go for your remedies. So you'll have calcareous carb and thyroidinum for puberty. You'll have thyroidinum for pregnancy, ferromyode and graphitis, and there's another remedy. Yeah, this calcareous iode again for pregnancy. So all these things will come. They're all written here in the book. Then Sir has also, because he's done a tangential analysis for us, that premature menopause can also be due to estrogen. Sorry. Estrogen. Or it can be because of the thyroid gland, right? So if there's decrease of estrogen, then we have to look for symptoms which may make us give euphorianum as a sarcode, or it may make us give them estrogen as a sarcode, or make us give them thyroidinum as a sarcode to overcome the symptoms of menopause at that time. These again have different indications: estrogen, euphorianum, and thyroidinum, which if you follow us, we'll be able to explain to you later. When we take the physical complaints of the patient to get the constitutional remedy, the physical generals also cover the thyroid peculiarities. So if the patient likes eating cold things, it can be iodine. If they like eating sweet things, it can be thyroidinum. Desire for salt is in natriuretic. If eating makes them worse, it's natriuretic. Aversion to certain foods is natriuretic. Dryness of the mucous membranes is natriuretic. Sweats while eating, natriuretic. Now, if you see natriuretic, it's usually sea salt. There is always a small percentage of iodine in it, which, along with sodium chloride, we get symptoms of natriuretic for thyroid gland. Allergies. Sir has mentioned over here about the use of thyroidinum, measles, and iodine in patients who have goiter with allergies. I would like to add a tip to this. If there is a family history of thyroid, or if there is a past history of measles, you can give the related remedy for goiter or thyroid affections plus allergies. So if you see a patient with goiter and allergies, ask them if they have a family history of thyroid, ask them if they had a past history of measles, and that will lead you to your indicated remedy. Remember, we were talking about congenital absence of the thyroid gland or congenital diseases of the thyroid, and we spoke about diet. And I told you that in homeopathy, we also have answers for this, which was the miasms. Now, when there's a patient of thyroid with a tubercular history, a history of tuberculosis, I have confirmed this multiple times in my clinic, and I can swear by it that this is only one sentence here in this book. But if you understand the weightage of it, you will cure a lot of thyroid cases only with this remedy. So if it is a tubercular miasm, then think of Drosera. And if it is a syphilitic miasm, think of syphiline. These are given as single doses to start the case and clear up the miasmatic background. And then we look for the constitutional prescription also of the case, because only syphilinum will not work. Syphilinum will be given as an anti-miasmatic, and then we will also be looking for a constitutional remedy. And if necessary, from the history of the thyroid case, we may also get another remedy which will help the thyroid to heal. Now, Sir's examination of the thyroid gland and the associated examination of the whole body is something you must amaze yourself at. Okay. We know there's hair fall in thyroid. We know that the skin will either be sweaty in hyperthyroidism or dry in hypothyroidism. But do we check it when a patient comes to us with a defective thyroid report? Atrophy of the gland. When we check and we see, oh, that's such a small thyroid gland, the patient follows and we're looking for it. Iodine. Even from the look of the neck, you can prescribe. Iodine is there, Natromur is there. The one that is from the chin to the goiter is Spongia. So even from the look of the neck. Then we have right-sided remedies and left-sided remedies. The right-sided remedies are iodine, lycopodium, sapia, and spongia. And the left-sided remedies are chelidonium. Imagine, we know this as a right-sided remedy, but it's a left-sided goiter, and lachesis. Then remember I mentioned to you about when you touch it and then you see whether it's hard or soft or rubbery or lumpy. Now, Sir has added a little more here. He talks about a nodular goiter or a cystic goiter. And according to the consistency again, Sir has mentioned the hard ones as bromium, iodine, and spongia. The lumpy one is graphitis, And we have a naughty one, as if there's knots in the goiter, which is calcarea iode. And if you see this, we will also know rubbery can be conium, rubbery glands. Soft will be your calcarea carbs. Now, this maybe Sir has not mentioned, but that's what I'm trying to tell you. He's giving us a map. We can fill it in with what we know also, but he's given us enough to go with and to take with us the first time. Now, this is what we have understood from the examination. I have not spoken a lot about the other conditions, because I thought for now, since you have just got the book, I don't want to overwhelm you all. So I have not spoken a lot about the Graves' disease and the thyroiditis and toxemia and things like that. I have not spoken a lot about Parkinson's with, or neurological disorders with thyroid, or cancers of the thyroid, because I think you should first start with the basics. Try doing hyper and hypo for now, and try treating your menstrual disorders with the knowledge of the thyroid and the role it plays. After that, what the rest of the book, we have the case paper format, which you can just copy and start using immediately, because now you know how to use it and how to interpret the symptoms that are going to come out of that. You will have the repertory, which is a small sheet. Now, that is not everything, but it will give you quite a few points where you might get stuck and say, oh, what was it that Sir mentioned? There was something he spoke about this gland, or there was something that he said about puberty, or there's something he said about lumpy nodules, or whatever. So then the repertory will help you in that. And he's given special indications in the Materia Medica. This Materia Medica is thyroid specific. Now, again, I mentioned that these are not the complete set of remedies that cover thyroid. You might have a thyroid case that will go with something totally different, which is not mentioned in this book. Very different. It is not complete in its own, but it gives you a lot to learn, and it puts a lot of the material is in one place. So your efficacy in treating thyroid with this book is going to be marvelous. I hope I have satisfied you with whatever I've shared with this book. If there is anything else, you can always contact me. I will help you through this book.